everyone, it's your host Felicia Dortch with Relationship Entertainment TV, coming to you on this wonderful Thursday with the news you can use and the ish you don't want to miss. So I promised you on Tuesday that I was going to go out on location to the Say My Name Memorial, but wasn't able to get to that today due to homeschool. You know, guys, I'm a homeschool parent and we didn't get quite finished with biology. So I'm gonna push it back to next Wednesday so I can make sure I have enough time to really go through the memorial and let everyone see what we have here in Houston. So I was going through the news and just thinking about things that was going on, and I realized that October is Breast Cancer Awareness Month. You know, so with me being a nurse, I love to bring you things that you could use and things that you need to keep in the back of your mind, especially for us women. But I'll tell you one thing, if you didn't know, men actually can get breast cancer. I'm not joking. It is the truth. You can look it up. It is the truth. I actually know someone that had this happen. And just to kind of give you a little information about it, it's the same process. And if you notice some men have a little more tissue up here. It's called gynecomastia, basically man breast. And, you know, they need to get in the habit of doing the self-checks as well. Now, one thing I haven't saw or was taught is a special technique for men to check their breasts. You know, so I would assume, my personal assumption is that they would do it the same way a female would, which is raising their hand like that and pressing around the breast tissue area. Okay, so men out there, I know that sounds hilarious, but you better get checked because it is real. And I do know actually 2 guys that went through that and had to have surgery. And with my background as a registered nurse, primarily in oncology, which is cancer, and operating room, I actually done those surgeries on a few men where we went in and removed the breast tissue. Some of it was benign. The lumps that we found were benign, meaning non-cancerous, and some of them were actually cancerous. And that was the first time I really understood what was going on. It was mentioned in nursing school, but it wasn't really talked about as much as female breast cancer. Okay, so it's real. So moving on with that, just wanted to get on here and say that, you know, to make sure, especially if you have a history of breast cancer in your family, a familial link, you have a higher prevalence of getting it yourself. So I always love to use examples about myself. I went last year, for the first time to get a breast exam with the little machine, the mammogram. My God, my experience, let me say it like that. My experience was one to remember. That was the most painful thing I've ever heard of in my life. But it's worth it. I'd rather go through the little 2 seconds of pain than to go through a lifetime of misery, you know, or to have to worry about cancer in my body or chemo or the sickness. I've actually worked with patients that have gone through that. I worked on the protective environment at MD Anderson Hospital, and that's one of the environments where everyone is so immunosuppressed that you can't even go in the rooms with them. When you do, only the nursing staff or medical staff can, and we're fully gowned with a mask. All they see is our eyes. The patient can't have family members in there. We can barely touch them. It's because they'll get sick so quickly, you know. So it was worth it. You know, I called and I told my kids that was the worst experience ever. I was actually being a huge baby, but it really wasn't that bad. And my understanding is they do have a machine that you can use now and request, which I didn't know this until I left the facility, where it's almost like a ultrasound type of machine that just kind of circles around it like they would do in an MRI. You know, the MRI doesn't touch you. You just lay there and the big circle, loud, noisy thing goes around you and takes the picture that it needs to take. Well, they actually have something similar to that instead of you sticking your breast in a machine and smashing it like a pancake, okay? So, but however, whichever one is covered by your insurance, it is super important that you take the time to get your mammogram done. And I'm gonna be totally honest and transparent with you. I was supposed to do it the year before last, actually when I turned 40, because I'm 42 now, and I didn't do it. I put it off and I put it off. And I don't have the family history of breast cancer. However, that doesn't mean it can't still happen to me. So I went this year because I do have girls and I want to show them the importance of taking care of your body. And I'm huge on making sure I listen to my body and doing the checks that I'm supposed to do at the times that I'm supposed to do them. Okay, so it was only right for me to go ahead and go, and I had put it off long enough, which is not like me, but and honestly, I didn't see the reason for me to rush out and do it, and I shouldn't have had that thought process at all. So I'm on here telling you that when you're supposed to go get your mammogram, please, ladies, go and get your mammogram. And that's with any type of cancer screening, because it's easier for us as medical professionals to get you during the diagnostic stage than the end stage where it's nothing that we can do. That was very difficult for me to watch when we would receive cancer patients in our facility. And, we're hoping that they're just in the diagnosis stage or the early stages. Then they can be treated maybe with targeted therapy or medication, or maybe one chemo round versus another, or just surgery, removing the lump itself. And so many of them, we got to it, they came to us extremely too late. There's a lot of trial type of medications or trials that they can do to hopefully research, hopefully find the right thing for them that'll work. But that puts a lot of stress on the body. And when your body's trying to heal, you don't need added stress to it as well. So it's better for you to go ahead and do those diagnostics now. So hopefully we can catch things in the early stages where your option can be just surgery to remove the lump, or just targeted radiation, or maybe run one round of chemo and be done, hopefully, and be in remission. So you have to keep those in the back of your head along with everything else that's going on. But when I saw that October was Breast Cancer Month, I was super excited because it celebrates a lot of people that have made it to remission, and it helps to drive money to that foundation or to that cause, so we can continue looking for research to hopefully when it is in those advanced stages. I believe that with the technology and the medical advancements that we have in 2020, we should be able to take care of those patients, even if they're at the end stages of cancer or the end stages of any type of cancer. We should have the ability to do that. I believe if we're able to get cells from the umbilical cord to help with Parkinson's, surely there has to be a way to, have some therapy or medications or ideas for cancers, not even just breast cancer. So definitely rocking my pink. I'm not doing it today because I'm in my relationship entertainment TV. But when I was thinking about something to talk to you about that was going on in the news, and it's going on everywhere. They keep talking about the breast cancer awareness. I have a really good friend named Nadine, and I actually talked to you about her foundation a couple of videos before this one about her Welcome Home Foundation, at which she goes in and allows the post-cancer patient, a patient in remission from cancer, and she redecorates a room in their home, which most likely is the bedroom because they spend the most time there in recovery. And her foundation gets donations and they have sponsors, and she go in and completely redecorate these homes. I mean, it's absolutely beautiful. Or she redecorate things that mean the most to them. May it be the living room, the bedroom, or maybe they need a bathroom redone. It depends on what's most important to them at that time. Because if you understand how cancer works, it completely tears the body down, so the rebuilding phase is exhausting. So that's why I say most of the time it's in the bedroom. So October, cancer awareness is really near to me, and it's not because I've ever had breast cancer or have anyone extremely close, like an immediate family member. I've had friends, as I stated, but no one very close to me. However, I worked as a cancer nurse for over 6 years. And it's very difficult to watch. And when I talk to some of those patients and they tell me about, they knew something was wrong, or they felt the lump and didn't think anything of it, or it was really small and they didn't realize what it was, or, sometimes we tend to have something going on with our body and we don't listen to our bodies. And because your body is a well-oiled machine, it is extremely intelligent. So you have to understand that when your body is telling you to do something, that is what you need to do. If it's hurting, that means there's a pain there, there's an inflammation there. If you do your breast exam and there's tenderness, and you're not in the breastfeeding stages, and we understand that when you're breastfeeding, your breasts tend to be tender. But if you're not breastfeeding, you are way past that, you know, got grown children, or way before that. Or even if you are breastfeeding and you do your breast exam and you feel something that doesn't feel right to you, or you're just not sure, it's super important for you to go get it checked out. You know, just if my shoulders bother me, it kept bothering me, and I'm pretty sure it's because of all the years of lifting patients, lifting operating room pans, because the pans are very heavy with the instruments in them. You know, my body is finally relaxing because I don't do clinical nursing anymore. So now I'm feeling all the aches and pains and the things that I may have messed up with sports in school as well as in nursing. And sure enough, I had some issues with both my shoulders, but I went and got it checked out. Another example, I was having some issues with my heart rate and didn't discover that till after I stopped running track, and come to find out I have a valve in my heart that doesn't close all the way. So, and I'm not saying that every time something happens to me, I run to the doctor, because I don't. I'm gonna be totally honest with you, I don't. But after hearing some of the stories from my cancer patients, hearing the stories of my friend Nadine and what she went through with her own trials, of her losing her mom to breast cancer, friends to breast cancer, and then her having a breast cancer scare, you know, was enough for me to really say, you know what, you're a nurse, you should be smarter than that. You should be listening to your body as well. You should be getting your diagnostics test, your exams every year as well, just like you would tell anyone else. So I wanted to come on today with it being the very beginning of October, you know, before October got away from us, and just to encourage you to support the Breast Cancer Foundation, you know, however you can, even if it's something locally in your city, or you know of a hospital that specializes in that. If they have any type of donating that you can do, and research, you know, I understand we donate and we worry how the money's being used, but do what you can for the Cancer Foundation, even if it's just not just breast cancer. But with it being October, I would encourage you to, all the women in your lives, all your friends, ask them, just call and say, hey, have you had your mammogram? And they may think you're nuts, but you're just showing concern. You know, making sure that there's something that they're doing to take care of themselves and taking care of you. And don't forget about our husbands, boyfriends, men in your lives, everybody, you know, they can get breast cancer as well. So thank you so much for tuning in to Relationship Entertainment TV. I'm your host, Felicia Dortch, with the news you can use and the issue you don't want to miss. Thank you. Bye-bye.